There are two types of shoulder replacements that we perform here. There's the anatomic shoulder replacement and the reverse shoulder replacement. The difference being in how they function. The standard shoulder replacement is a resurfacing, so we resurface the joint and give it a nice smooth surface. For this to work, you have to have a perfect rotator cuff, good bone stock, and minimal or correctable deformity of the socket. The reverse shoulder replacement has a robust fixation into the socket, and we reverse the anatomy to change the mechanics and how the shoulder functions. It works without a rotator cuff and works in the situation of bad arthritis, especially if there is poor bone quality of the socket or deformity. The choice between the two surgeries is based on multiple factors including pathology and patient factors. Both are generally out-of-patient surgeries, taking less than an hour to perform, and we will use a small incision in the front of your shoulder and it will be closed with self-absorbing sutures. You will need to be in a sling for a month and protect the shoulder for 3 months after surgery. You will be given exercises for home or prescribed physical therapy. Gentle strengthening will start at month 2 and 3, and slow progression to full strengthening will progress over the next 3 months. You will be able to return to golf and other activities as early as 4.5 months. Full recovery typically takes between 6 to 8 months. However, most patients feel significant pain relief and better function as early as 1 month. 93 to 95% of these implants are still lasting well over 10 years. Infection and revision rates are very low, and the risk may include bleeding, pain, infection, damage to nearby structures. In the case of an infection, the implant may need to be removed, but if it is superficial, antibiotics or simple debridement can sometimes work. Dislocation of the shoulder is possible, but rare. There is a risk of an acromial stress fracture on the outside of the arm with a reverse total shoulder arthroplasty. The risk is low, and if managed appropriately, there will not be any long-term consequences or long-term dysfunction of the shoulder. Overall, the complication rates are incredibly low, the success rate is very high, and patient satisfaction is very high.